Hello, everyone. Today we are going to talk about the toxicology of medications or substances and the drugs of abuse. So just quick, before we get started, I will be posting this illustrated toxicology and toxidromes on Blackboard as a study tool. So please just use this if it helps. If it doesn't help, don't worry about it. But I was given this by one of your bigs. Shout out to Tori Slagle. Thank you so much for thinking of me. One of your classmates or upperclassmen went to a presentation over the summer and got a copy of this for me. So I thank you so much. And she thought it'd be beneficial for you guys. So, hey, thank you, Tori. And you guys should all send her like a thank you card, like buy her a coffee or something. I don't know. Give her a shout out now. No, but yeah, so that was very sweet of her. And I always appreciate when students help me as far as helping me to help you. So it's pretty current. A lot of the stuff hasn't changed. A lot of the toxicology stuff is kind of older or whatever, but let's see. It has some different mnemonics, talks about respiratory rate, different things. Just some things that I think should help you study for my exam and maybe for ICM, and then definitely for your board exam. This stuff will definitely help you there. Notice the anticholinergics. We've talked about those before. Some drugs that have those. So yeah, definitely. I like this too because I'm visual, so this would help me as far as like learning the treatments and stuff. Because for this toxicology presentation we're about to get into, it's definitely going to be offending agent, which is the toxic substance, and then the antidote. So guaranteed exam questions, toxic substance, antidote. So cholinergic treatment, what do you give? You give 2-PAM, atropine, benzotrine, and supportive care, which I'm going to be focusing on the medications, right, for my exam. But guaranteed going to be on my exam question and guaranteed going to be on your board exams. So these are like favorite board exams. They always put these. And it's just, again, what did the patient accidentally or intentionally over ingest? Did they have an opioid overdose? And then how do you treat it? So again, guaranteed exam question for me and on your board. So hopefully this helps. Again, thank you, Tori. Appreciate it. I know she's not listening, but you guys can thank her, whatever. And I always appreciate you guys helping me out to help future students. So thank you for that. So this will definitely be posted on Blackboard. Let me know if there's any issues with it. It is a PDF. It's not locked or password protected or anything. So it should be good. Should be good. But anyway, so let's just jump into this toxicology and drugs of abuse. And like I said, I mean, for exam purposes, guaranteed test questions come from here, and guaranteed, you gotta know your antidotes. So we have some Vicodin right here that looks like it would make you oxy-content if you ate it for breakfast. No. All right, that's just bad jokes. Those are some of my dad jokes there. But yeah, I have a couple things there that I think about when I think about toxicology and drugs of abuse. A little bit of background here, general principles of toxicology, just so everyone's on the same page, because I'm not sure if you guys go into detail on an ICM on this, but anyways, toxicology is a study of hazardous effects of chemicals, including drugs, on biological systems, and so medications are one of those things that unfortunately can be toxic, which you guys have been seeing year long from me, these adverse effects and these toxicology of some of these medications, or the toxicity rather. And it's going to be a reflection of how much the individual ingested, how quickly they ingested it, and then how long they were exposed to the toxic substance. And was it intentional, unintentional? Did they have a big dose, low dose? And so the primary determinants of toxicity are going to be dose and dose rate, the duration of exposure, and then how did they ingest it? Was it via their stomach? Was it via their vein? Did they breathe it in? Was it, something they were exposed to that was in the air? They inhaled it. That's all going to be things that we're going to have to take in consideration for the antidote and then also for the treatment of your patient. Some other factors that can affect toxicity are biotransformation. This is basically the way that your body deals with these toxic agents. And again, with both these slides, it's just an FYI thing. I'm not going to be pulling specific test questions from here. Just knowing that, there's different enzymes involved, there's different mechanisms involved, and biotransformation is one of those. There can also be some genetic components, so polymorphic metabolism. We've talked about this a little bit before with some medications, like, for example, codeine. We talked about that in the past. And so you have the fast or slow acetylators, and so basically their genetic makeup, or if they have a polymorphic target, can affect whether or not the person has, whether or not it's a toxic dose. So, because one dose could be safe for one person, but it could be unsafe for another, depending on their genetic background. And again, just FYI for me, for testing purposes. We also need to think about the immune status of the patient. So that is specifically, are they allergic to medication? So again, something we've thought about. So a medication can be toxic to an individual if they have a type 1 hypersensitivity to it. So for example, with penicillin and your sulfonamides, or a sulfa allergy. Photosensitivity is another one that can be altered by, well, this partly can be from your genetic background, but it can also be altered by some medications. Some medications can increase skin photosensitivity. So that's something to be mindful of. And then species differences, which is interesting. So some of these, like insecticides, humans, we don't have problems metabolizing them, but then insects, they can be deadly. So that's something also to think about too, that some things may be toxic to us, but then not toxic to a bird that ingests it maybe, or a fish or something. Or so anyway, so that's something again. And then again, this is just FYI, just some background for you guys. The age of the person can have an effect on the toxicity. So is it a pediatric patient you're treating who ingested a toxic substance unintentionally, or is it an elderly person? So that can, also there can be gender differences, and then environmental factors as well. So I'd encourage you guys to read through those, but also FYI. There's can also be nutritional status or protein binding. So again, what has a person ingested as far as food and other things that day. And then drug interactions. So we definitely have talked about those throughout the year. And so sometimes drug interactions can increase the toxicity of certain chemicals, but then also of other drugs. And then we have environmental pathology, which you don't worry. I just see chapter 6, rep review of pathology, but you don't stress about that. It's just FYI. But basically, there are things in the environment. So like, let's say there's lead paint at your house, or, there's different mercury in your water, or lead in your water or something. Different toxic substances can be environmentally found sometimes. Symptoms and treatment of acute poisoning. So the general approach to the poison patient, I'm going to read through this, but again, it's not going to be something I will be specifically testing you guys on, with the exception of I will be looking at the antidote. So definitely make sure you are memorizing those antidotes. Just general background again, too. You usually start with the ABCDTs of treatment. So airway, breathing, circulation, and drugs, and then temperature. So these I would pay attention to. These are the drugs. This is going to be the part where I will be taking exam questions from as far as their treatment, but everything else is good just to read through and FYI, and it may be beneficial in your ICM course. So definitely here, want you guys to put a big star here. I want you guys to know the offending agent or the toxic substance and the treatment of choice. So definitely make sure you know those. Also want you guys to know the clinical features of these offending agents. So what happens with acetaminophen? You have elevated PT, increased transaminase levels, hepatic necrosis. How do you treat it? Acetylcysteine. And then comments, these can be important or not, just kind of depends. But so commonly used for suicide attempts, over the counter, unfortunately. And so it unfortunately can be used for a suicide attempt. So definitely put a big star on this table. Want to make sure you guys know this for testing purposes. Again, another table, put a big star by, guaranteed exam questions, guaranteed board questions, antidote and poison. So know the poison and then know the antidote. So again, guaranteed. You can talk to your bigs. I'm not, this isn't something I'm making up. It's going to be on your exam. I think you guys trust me by now as far as if I say something's going to be on there or not. And it's just one of those things that you just have to go through and just memorize, just rewrite, just go over it over and over again, etc. You may need to remove the stomach contents if indicated. So we have this gastric lavage here. You can read through that. Definitely pay attention here. The substance used to reduce absorption of poison. We have charcoal, activated charcoal, and cholestyramine, which you'll remember from when we talked about the cholesterol medications. So yeah, the activated charcoal specifically can absorb many toxins if given immediately before or after the gastric lavage. Agents for which activated charcoal is not recommended. This is important too, to make sure that these are the ones that when you're in the ER, you're in an emergency setting, you should not give activated charcoal for everything, and specifically it's not recommended for these substances. Also you may need to induce emesis, so make a person vomit. So just go ahead and read through this. And specifically highlight here that you cause a person to throw up by using Ipecac. History and physical examination provide clues to potential exposure. So I won't be testing you guys over this, but this may be important for your ICM course or for some of your other patient eval course, or I don't know what these this is covered in other things, but don't worry about this history and physical examination for me. Other than, do know which medications can cause hypertension, tachycardia, so please note these, and please note which ones can cause hypotension and bradycardia, which by this point in the year, the end of the year, these should not be a surprise. I mean, it's things we've talked about before. Stimulants cause hypertension, and these blood pressure medications cause hypotension. The hypotension with tachycardia, we have our TCAs, phenazothiazines, theophylline, and the beta-2 agonists, and rapid respiration, please note those as well. Hypothermia, again, know which ones can cause hyperthermia, and then know which drugs can cause hypothermia. This is important, and again, can be testable for my exam. Make sure you know the effect on the eyes, which one causes pupil constriction. So opioids, you hear people talk about those pinpoint pupils, and then which ones can cause pupil dilation. So you have your cocaine, LSD, PCP, anticholinergics, and your amphetamines. Skin, some medications or some agents can cause flushed, hot, and dry skin. So we have your atropine, antimuscarinics, excessive sweating, have a list there, and cyanosis. Jaundice, which is liver toxicity. Here are your offending agents there. Tylenol's on there, and again, it's a big offending agent. We talked about that in the MSK module. Abdomen, again, just rogue memorization. I'm really sorry that there's not more to this, but please make sure you're looking at those as well. Nervous system, again, which ones can cause twitching, muscular hyperactivity, which ones can cause muscular rigidity, and then seizures, or seizures an issue. What do you use for that? Usually it's going to be IV diazepam or lorazepam, so you're going to go with your benzodiazepine. We have some agents that can cause seizures. So theophylline is one. All of these can lower the seizure threshold, so increased risk of seizures. So make sure you're please looking at that. Flaccid paralysis and coma. So we have these, anything that's extremely sedative, CNS depression, and your opioids. Treatment for all poisons. You have symptomatic, supportive, and then the antidotes, which again, definitely want to make sure you guys are studying those for exams. This one is just FYI, don't worry about the electrolyte analysis, but that is something you will be doing when you're on your rotations. But for my exam, you won't need to worry about. And then we have some examples of toxins that elevate the anion gap. So that can help you determine if the patient is unresponsive, maybe what they ingested. It also may be beneficial to do, they'll probably take the renal and liver function test. Same thing here too with the osmolar gaps. Just FYI, you don't need to worry about calculating this. There's not going to be any of this math on this exam. And it's just something, again, you may have come across on your rotation, so that's why I included it here. There are toxicology screens, so they will do a tox panel in the ER, and that can help a lot. But sometimes it depends on how the speed of those and what facility you're at. And then you may need to do a CT of head trauma is suspected. The ECG is probably going to be done as well. And you'll see if, again, that can help you kind of determine the offending agent. And you definitely need to be mindful of the patient having arrhythmias. Torsades de points, something we've talked about, the prolonged QT interval can be caused by a number of drugs here. So a lot of these are review from things we've seen throughout the semester. Some issues that can actually increase the risk of torsades de points, and then your treatment. So definitely put a star by that. The magnesium sulfate is going to be your drug of choice to treat that. These toxic substances can also alter the urine pH. So that can also give you an idea of what is going on and what, so for example, amphetamines cause acidification of the urine versus salicylates cause the alkalization of the urine. The cathartics and whole bowel irrigation may be indicated as well. So this is where there's the so-called body packers. So this is where people in drug trafficking will swallow condoms full of drugs of abuse. And so this may be a reason to administer those. And then 2, you may need to clean the blood. So hemodialysis, peritoneal dialysis, and hemoperfusion may be indicated to increase the rate of excretion when it is considered appropriate. But that's just more FYI. Don't stress about that for my exam. Teratogenic effects are definitely something, again, we've been talking about throughout the semester, so please make sure you're reviewing those and you are studying this table, and put a star by this as well to make sure you know which ones are potentially toxic to the fetus. Drugs of abuse here, as promised, please make sure you are studying these, put a star by here. Want you guys to know the drug, the effect of the drug, the withdrawal, and then the treatment of the drug. So guaranteed exam question, a person will come in, their friend said they were at a party, they took some substance, they had these symptoms, what's the offending agent, like what are they on? And you have to be able to tell by the question and their symptoms, what they ingested. And then maybe I need to know too, what would be the treatment then for what they ingested. Dependence and drugs of abuse. So with drugs of abuse, you have physical dependence and psychological dependence. And some are more offending agents or more offensive than others. So for physical dependence, you have to be concerned with ethanol, barbiturates, and the opioids. We have the stages of ethanol poisoning. So this one, don't worry about memorizing for my exam, but it is good to read through. We have some symptoms of drug dependence. We have repeated administration produces altered or adaptive physiological states, and then the signs and symptoms of withdrawal. And the withdrawal, depending on the patient, can last days, weeks, months, or longer. There's also psychological dependence, and sometimes it can be in combination with physical dependence. Sometimes it's separate. Some examples of those, you have amphetamines and cocaine. And affected individuals will use this drug repeatedly and kind of independent of the negative consequences. So a lot of times this will be detrimental to the person's personal life. And with chronic users, they result in a cluster of symptoms. So, and this is just all FYI for my course. Like I said, I want you guys to focus more on the medications, because I believe this will be covered more in your ICM course. But yes, the chronic user results in a cluster of symptoms: craving, withdrawal symptoms, drug-seeking behaviors. And like I said, they continue despite the substance-related problems. So this continue despite the social ramifications, financial, and the medical ramifications. So that is it for me. Thank you guys, as always, for your time and attention. Please feel free to email me any questions, comments, feedback, anything else you'd like to know. I will talk to you guys later.